I got Carhilla, Cowell and Tara, Slanta, Tasha Aslaw Arish. It's like Carriena mit Festig on Eimer, Tarder and Gwinter Law, Carriena mit Festig on Tara. How is she? He'd never ever here to deal with serious debates. No disrespect to Minister of State Feehan, but the Minister for Health, she's so precious. And if he is here, he's left before any of our groups come to speak, and it's a total abdication of his role as Minister, and he's our right to have him present for these debates. Look, this debate anyway, and someone referred to it as like the finance bill or the social welfare bill. At least with the finance bill and the social welfare bill, people get something out of it, and they might get some lose things out of it too, but at least it's a cogent piece of work. This is like paper in the parlour for the station mess. You come in here, this bill, because the health insurance, it's a wild west out there, and people have health insurance, and and there's so many excesses on it. They're so restrictive about getting it, and then you happen to cover your need when you go into hospital. You have to pay all these excesses on top of it, and it's totally unfair. We have a two-tier system not working. We went off then and did a massive deal for the COVID with the private hospitals instead of buying one of them. Compulsory purchase order. We brought in legislation to stop thousands of small businesses operating, and we can't do anything with the private health because we know the powerful men who own them. That's what's going on, and we're lining their pockets. So we need to have a proper, meaningful legislation that's robust enough and that would deal with the racketeering that's going on. There's some powerful and excellent specialists and surgeons and doctors, and I support them and salute them, but as I said, the charges. Then go into hospital, and my own brother-in-law lately went into hospital after having a mini stroke. And my sister went with him, and the nurse insisted at the A&E that she travelled back home 12 miles, 11 miles to get his PPS number and get his private health insurance number. Because they want to, even though he's sitting on a chair and didn't get a bed, they want to charge that insurance. They want to charge for the cost of a bed. You stay in the Gresham, cheaper, or in the Burlington, or any lot cheaper. And get a lot of service too. When you ask for service, you get it, because the nurses are so stretched. But this is shameful what's going on. People, insurance premiums have been hiked up because of the claims, and people don't even know this happening. If you're in there, you're going to have have a test or whatever. Just slip this little form in front of you. You know what I mean. And you sign it. And you try anything if you're ill and you want to get better treatment. So it's not right what's going on. It's very, very wrong indeed. But then why wouldn't we have that? And blessed Count Cola has arrived now. Why wouldn't we have that? When we had Minister Donnelly here through March, April and May, when the HSE seconded a lovely hospital, a beautiful hospital, it's there since the 1800s, 1820 or something, in Carrick-on-Shore. They seconded that for COVID step-down patients. And we've been told, and I know the councillor, Kieran Burke, very hard-working councillor in the town, came up here and met the Minister Donnelly. I met him the same evening, and he was sure that would be returned as a hospital. There's 3 hospital beds in it. Do tremendous work, and huge fundraising was done for that as well by the locals, both South Kilkenny, West Waterford, and indeed in South Tipperary. And we were told again by Minister Harris that it would be reopened. And we're told today, the staff were informed this morning, it's Dunta, shut, finito, gone as an institution. A proud institution and a wonderful staff there, and investments built in, and they built a huge monstrosity, cost 10 million then, of a primary care centre right beside it, and that's half empty, full of. And now we have the hospital has gone, no more hospice beds. I'm promised by Minister Butler that there'll be some private arrangement with nursing homes. Everything is private. Push it out into the private sector where people are fleeced. The care that they got in the palliative care there, and the care that they got from the specialist nurses and the other ancillary staff helping there was fabulous. And it was known locally. Many people in Carrick-on-Shore were born there. It was a maternity hospital. And now it's no longer. And the deceit and the lies that we were told is shocking. And no accountability. The Minister now will not even reply to Councillor Burke. Registered letters he won't even reply to him. Or neither will the Taoiseach. He's Fianna Fáil leader. He's so disappointed and meant to serve the people on a voluntary basis almost, and he trying to do his best, and others. And the people to campaign to have it reopened. And now to find the lights are turned off and they're never going to be turned on. We're promised there's going to be a step down for diabetes or something else. We want that there as a respite. We want that for a hospital when people are ill, the areas that step down from other hospitals after surgeries. People have died now without the palliative care they were entitled to. I know that the palliative care teams and nurses do tremendous work in their homes, in the houses, but people need a bed in a hospital. That's where they are, locked up, gone away from the people now, access, after people fundraising so much for them for years to put them in there. And they were put in there in the new extension of the hospital. Beautiful. I've been in it to see people on the last days, and it's so sad. So, I mean, the Minister then, He's gone like snow off a ditch. As I said before, another night here, he's gone out to, like a cat wouldn't go through a skylight as fast when we get up to speak here. With fear, and not being accountable for this house is scandalous.
Thank you, Deputy.